There's a whole class of these remote care programs that we like to discuss with clients, right? The main one a lot of practices have heard of are chronic care management, or CCM. This is basically patients who have two or more chronic conditions like high blood pressure or diabetes, and that allows them to have a pathway to kind of manage that over time. So basically, these are Medicare patients that having a nurse that can reach out to the patients and making sure they follow, understanding their care plans, understanding, what diet to consist of, but ultimately making sure they kind of manage those chronic conditions so that they don't stay under control. And the goal is to kind of make it under control, right? In the timely manner. Chronic conditions, never go away, but they can be managed more effectively with preventive healthcare, and that's what chronic care management does. The next level is remote patient monitoring, or RPM. This is using devices to kind of add to the clinical care remotely. So having a blood pressure shipped to a patient, they use it every day, so you can get data back to the clinical staff, is extremely valuable because now the practice is getting data to understand how best to take care of you, but more importantly around understanding your diet, understanding how you can manage stress, understanding your medications, right? And so having that data is so vital. And that's what RPM does, provide more data points so they can make the best decision on a whole class of evidence-based studies that show what happens if patients can change their behavior when you're monitoring their data remotely. And so that's something key, but also it's important for patients because it keeps them engaged in their own care, and they care more and they change their behavior over time.